Hello everyone, I am Alvarez Karen, and today I want to share this interesting topic that is about artificial intelligence to detect papilledema from ocular fundus photograph. Definition: artificial intelligence is an area of science whose purpose is development of computer systems that generate intelligent behavior. An artificial intelligence algorithm trained and in ocular fundus photographs shows high sensitivity and specificity to discriminate between normal and alternate optic nerves.
Google DeepMind is training its artificial intelligence software to detect early signs of eye diseases. It's aimed at detecting two diseases, age-related macular degeneration and diabetic retinopathy. The latter can lead to blindness if not detected early. DeepMind is analyzing about 1 million eye scans to develop an algorithm that can catch early warning signs of the conditions.
If you have an OCT scan done, a machine learning algorithm will be able to tell you if it's something urgent versus something that's not so urgent. It will allow us to get much earlier detection of these blinding diseases.
The company has caught flack from privacy critics in the past. It was using patient data to develop an app that identifies the risk of kidney failure, and some said it was allowed too much access to patient information. But DeepMind says the eye scans were handed over without any identifying information about the patients they came from and are supposed to be completely anonymous. The UK's National Health Service and Moorfields Eye Hospital in London partnered with DeepMind to develop the machine learning system. For Newsy, I'm Cliff Judy.
Hola.
Application in nursing. This nursing staff will be charged of preparing the patient by dilating his pupils. Then they will take a photograph of the fundus and then upload into the computer and have them analyzed.
So, Ms. Moran, I've been told that I have papilledema. Can you tell me more about that, please?
Yes, so papilledema is what we can see when we examine the back of your eyes, and what that can be is it can be a sign of raised intracranial pressure. Now, it's sometimes not very easy to tell whether people have what we say is papilledema or pseudopapilledema. And what I mean by pseudopapilledema is that sometimes the nerve looks swollen and elevated, but in fact it's not due to brain pressure. So often when we go to the opticians and they look in through an undilated pupil, they get the impression that the nerves are elevated, and that signals for them to send somebody urgently to the hospital to be evaluated. When they come to the hospital, quite often the doctors look with what we say is called an ophthalmoscope. So sometimes they're not able to put drops in the eyes, and they actually look with a torch in the eyes to have a look at the elevation of the nerves, because they need to confirm whether the nerve is swollen or not. If they're unsure in the emergency situation, they often ask an ophthalmologist, an eye doctor, to come and have a look at the back of the eyes.
More experience of the eyes.
Yeah, and also we've got sort of more useful instruments such as the slit lamp to be able to have a good look at the back of the eyes and evaluate whether we think there's true swelling or whether it's pseudo swelling. So some of the causes of pseudoswelling can be little deposits such as drusen at the optic nerve head. These are tiny little refractile deposits that we can sometimes see when we do an ultrasound of the eye. So we ask the patient to close the eye and put some jelly on, and we use a sort of device a bit like
an ultrasound.
Yeah, Yeah, just like on what pregnant moms get to look at their babies. So it's sometimes a very useful way to determine whether there's drusen present or not. But sometimes it's even more difficult than that, because sometimes you can have drusen as well as swelling. So you can see that there's lots of different things interplaying. So it's always important that the diagnosis of papilledema or true swelling in both optic nerves is evaluated before invasive tests are done.
Pros and cons. Pros. It has 95% accuracy in this diagnosis, and therefore a better treatment will be given to patients. Cons. It should be affordable for all countries and patients.
Papilledema is swelling of the optic nerves secondary to raised intracranial pressure. Therefore, in any patient who has worrisome headaches, it's important to examine the ocular fundus looking for papilledema. Depending on the duration of the pathology which has caused the raised intracranial pressure, papilledema can go through various stages. The earliest stage can be quite subtle and difficult to pick up. It involves subtle swelling of the optic disc margins, mostly where the nerve fibre layer is thickest. So to start with, this is superiorly and inferiorly, and then later nasally. As papilledema becomes more established, the swelling can progress circumferentially around the optic nerve, leading to a blurring of the optic disc margins. Established papilledema is associated with hemorrhages on the optic nerve head and also around the optic nerve head, and in addition, the central vessels on the optic nerve can become obscured as the tissue swells around them. Chronic papilledema is where the optic nerve is still swollen, but also the disc appears pale due to loss of nerve fibre layer tissue. And then we go on to the end stage of papilledema, which is called atrophic papilledema. At this stage, the optic nerve head is pale, but is also flat due to the degree of neural tissue loss. Other important features of papilledema, including the fact that it can be asymmetrical, which is why it's important to examine both eyes, and also in chronic or severe swelling, you can get associated protein deposits in the macula beside the disc, telling you that the papilledema has been there for a significant length of time. The most worrisome symptom associated with papilledema is headaches, particularly worrisome headaches. With regards to visual symptoms, there are remarkably few until papilledema becomes established. At that point, the patient may report episodes of transient visual loss. These can last from a few minutes to a few seconds and can involve greying out of the vision or positive visual phenomena such as bright flashing lights. After each attack, the vision should recover completely, and they can be precipitated by moving from a sitting to a standing position. It is only when the papilledema becomes end stage or atrophic that the patient will then be aware of visual symptoms such as visual blurring and or loss of visual field. The main group of conditions that can mimic papilledema are the anatomical variants of a normal optic nerve. These would include disc drusen and the crowded optic nerve, which can be found in patients who are long-sighted. However, because both these conditions are just anatomical variants, they should not be associated with headache. Conditions causing inflammation of the optic nerve can also cause a papillitis or inflammatory swelling of the optic nerve, but these conditions affect vision early, unlike papilledema. It has been suggested that pulsation of the vein on the surface of the optic disc can be used as a surrogate marker for normal intracranial pressure. Although this is sometimes true, this sign should not be used to differentiate papilledema from other causes of anomalous appearing optic nerve heads.
Use and apply in Ecuador. Can Jan, an ophthalmology specialist, California, USA, and his colleagues use an artificial intelligence based neural network to review more than 200,000 ASS animation performed with optical coherence tomography. This technology has not been implemented in Ecuador yet.
Ready? Today we're going to be talking about papilledema, and as the name implies, it's edema. Cranial pressure from pseudotumor cerebri, the idiopathic variety. Papilledema is an emergency because we want to make sure that it's not things that need to be treated today. And the first thing we need to do in every patient who has papilledema is check the blood pressure, because if we have papilledema from elevated blood pressure, that is evidence of target end organ dysfunction and is grade 4 in the Keith Wegner classification of hypertensive retinopathy. So grade 4 hypertensive retinopathy is papilledema, but any Friesen grade of papilledema actually qualifies for grade 4 hypertensive retinopathy, and grade 4 hypertensive retinopathy can mimic what looks like papilledema. The second thing we need to do is we need to do an imaging study. And the imaging study of choice for papilledema is a contrast MRI of the head and orbit with MR venography. The venography is necessary to look for venous sinus thrombosis. And then if the MRI, MRV is normal, then of course we're going to do a lumbar puncture to measure the opening pressure. And if the CSF content is normal, but the opening pressure is elevated, that meets the modified Dandy criteria for idiopathic intracranial hypertension, IIH. However, some patients with papilledema come to you months after they've had symptoms. And you do the visual field and it's just an enlarged blind spot. They've had headache and symptoms of elevated ICP. They're an obese female. So those patients, I don't think, have to have any admission to the hospital and can be worked up as an outpatient.
In conclusion, artificial intelligence to detect papilledema of ocular fundus photograph is improving in development, providing better photographic quality and processing speed. This application completely changed the way of diagnostic and treating the disease. Benefit patient to timely treatment.
Next, your vision will be assessed. We will look at the general, obviously once we've had a discussion about your symptoms and gone into that from that point of view, we'll then be able to assess the health of your eye. This will involve often having drops put in and having various specialised tests taken, essentially photographs of the eye. We've got some really very useful tools that we never had before that can look at your nerve in detail. You may have had those done at the opticians already. Some people may have even seen a photograph of their nerve. But sometimes you need somebody who deals with actually who's got more experience of dealing with disease states to know that what you have is a completely normal nerve and to talk through things with you. If there's concern that you've got swelling of the nerve, then we will need, or if there's even the suspicion that that's what it might be, we will need to do some further investigations. Sometimes that can involve undertaking an MRI scan of your brain. In many people, though, it's usually that I can reassure you and let you know that yes, your nerve of sight, your optic nerve may look a little bit swollen, but this is just natural and normal for you. Your eyes have probably always looked like this. There are other conditions that can look very much like a swollen nerve, again, that are very common in the population. And one of those is something called disc drusen. which are essentially little deposits that can form in the optic nerve and give the impression that the nerve is swollen. Many people with disc drusen don't even know about it, and there are estimates that it might affect 1 to 2% of the population, which is a large number of people. So if you have any concern that you have disc drusen, I'd be very happy to see you at Clinica London, because I think it is important that we establish pretty rapidly whether you have something that needs further investigation or whether this is just what is normal for you. And I don't think you can underestimate how reassuring that is for patients, particularly if you're one of these people who has the very common symptom of a headache. The question is this of any relation to what your eye appearance is? And that's hopefully something that we'll be able to do very quickly for you.
Okay, I thank you for attention.